Okay.
Hi, I'm Diane Sater-Wee, and I'm co-founder and co-owner of American Institute of Alternative Medicine. And today I'm going to be talking with Hong Chen, who is our acupuncture program chair, about pediatric acupuncture. So, Hong, if you can introduce yourself. And I know that you did your training in Beijing, and you were a physician there and really specialized in working with children and doing traditional Chinese medicine. So I asked you to share what makes pediatric acupuncture different than acupuncture, and I will step away, and I'll be behind the camera so that I'm socially distanced from you. So.
Hello, everyone. My name is Hong Chen, and I'm a licensed acupuncturist and specialize in pediatric acupuncture. Actually, acupuncture is for all ages, and you with acupuncture get more attention, and it's people more interested in or have questions about pediatric acupuncture, because as a parent they got acupuncture, they thought it natural, effective, and a safe treatment approach for a variety of medical conditions. So they want their kids to try it for different issues. So today I will talk about pediatric acupuncture.
So pediatric is under what age?
Yeah, age for the age of groups from babies to teenagers. So baby from birth until 2 years old, and toddlers 3 years to preschool to the 6 years old, right? And also preschooler and also school age children up to like 13, then from a teenager 12 to 18, this range of age.
Okay.
Yeah.
So you kind of break them up like that. Is that because the energetics in the human body kind of develop differently?
Yeah, yes. In general, the physiology and pathology of pediatric are different from adults. The younger, the more difference, right? So their body anatomy already, or all the body part already formed, but the functionally weak. They are weak. For example, they have less muscle mass, they have less muscle build, and as well as weak immunity tends to get infections. Also the digestive issue. So the younger one is more problem involving respiratory as well as digestive system. But as children get older, probably after puberty, okay, so they're physiologically more like adults. Yeah.
Okay, that's interesting. So when you're treating an infant, are needles ever used?
Actually, pediatric acupuncture is a special type of a practice mainly use non-invasive treatment approaches, including Chinese Tui Na massage, as well as cupping, Gua Sha.
Cupping and Gua Sha, okay.
Or Tijan, special tool, as well as using the pallet ball, at least using the needles, the invasive procedure with needles. So with different age of a group of children, so usually when I treat kids, I initially start with Chinese Tui Na massage, then or mainly use that strategy. Okay. So what the difference of those approaches? So Chinese Tui Na massage use finger. Okay, working on, it's kind of a type of body work on different area on the body, but a little bit different from acupressure. Acupressure, you just work on acupuncture point. This one work in different region, area, okay, as well some acupuncture point. Okay, those area usually we don't work on adults. That's unique in the pediatric. Another is cupping. So this is a tool. So this also considered as non-invasive. Usually use this technique on the back, stimulate those area, upper middle back, for respiratory and digestive issue. Okay, and also we use this one called a T-chin. It's blunt tip.
Blunt tip, yes.
Yeah, when we press down, there is a spring inside, can stimulate certain points. Okay, you can
see it up close. It's got little spring loaded, and it's got a blunt round end, so it can get in real specifically, and you can make it harder or less very gentle.
Usually we do cuppings when they suck on the skin, is to leave it for 5 minutes and take off. That's all. And this one we press on different spots. Okay, kind of gently gliding along the acupuncture meridian. Okay, to stimulate those points. And I have another tool, different kind of shape of Gua Sha tool. We call it Gua Sha scraping. Gently stroking along the different area of the body. Okay, to stimulate to balance the body by stimulating the different spot or area, different shapes.
Yeah, they're different shapes.
Different shapes.
I like the one that has like a comb.
Yeah.
But so they've got different kinds of edges that can
get
in
different work
around.
on the area or work on spots, small spots. Okay.
So what does Gua Sha do? Scraping?
Gua Sha is by stimulating the surface of the body, we call then to affect the function of the internal organ.
Okay.
So that's similar as the cupping.
To the cupping.
Yeah.
Okay.
So this also the Chinese Tui Na massage. We use finger. We can use this one. Okay, this one to replace certain technique. Okay. Also, we have this tool. It's called microcurrent pen with battery. When we turn on to certain hertz, so it stimulates certain point. This is kind of modern tool we use, but the kids won't feel anything. Okay. It's the micro electricity is so low. It's same as our human body's physiological electricity level. So hardly to feel, but it has a therapeutic effect. So those are considered non-invasive. And another tool we use is like pallet ball. So you see this different color. One is gold, one is silver. That's on a different base. So let me peel one. Okay. Okay, so usually we'll put on the finger like this. Okay.
I don't have dirty fingers.
No, I don't see the clean up. I just look at the spot should put on. Okay. We can go like this. Okay. Then we use pretty bandage. What the baby or kids like. Let me put the bandage so it won't lose it. Okay.
So I don't lose it.
Usually we let the kids keep it for 2 hours. Okay, this is pretty rabbit. Okay. So the kids won't take off. So this one, you don't need press
So
on.
it says
you don't
baby.
feel anything.
It's got a little rabbit.
So that's the paddage. Work on the point on the finger. Mainly we put this one on the finger.
So these ones are silver?
Silver
Pellets?
and silver coated and gold coated. So different therapies
Different.
that use in combination to stimulate that meridian
Okay.
on the hand to work on your
Reflexively.
reflexively affect your internal organ. So that's the two. And lastly, the invasive approaches we use is a tiny needle. Okay, if so as I said, initially I work with the kids. If they accepted with the needle, okay, by talking to them, explain how the needle works or what it looks like. Eventually, if they agree with using a needle, so I will use very, very fine needle. It's called pediatric needle. It's so small, hardly to see.
But it's like smaller than my finger.
Actually,
it's
when we work on the
super
kid,
thin.
Yeah.
I don't know if you can, very
when we work on this,
flexible.
using the acupuncture needle, we tell them we just tap. We don't say puncture. So in that way, they won't take away of their fears. Okay, so you just tap. So then the needle stay in the skin. If they're okay, comfortable, then we leave the needle a little bit longer for 1 minute, then take off. If they're get older, they're okay, so we leave them maybe 10 minutes. 20 minutes for teenager, we can leave that for 30 minutes. Okay, and also if we have to use needle for baby, okay, like 6 months old, so they will kick, they will move. So cannot stay. We just do quick needle, puncture, put in, then take off. Okay, we won't leave a needle on the body.
Okay.
Yeah. So that's those are major tools we use. Mainly is non-invasive treatment approaches. That's a different.
Okay.
That's the difference between pediatric acupuncture and general acupuncture for adults.
Okay.
Yeah.
So Twina is a form of body work. So it's like massage, but instead of really focusing on muscle, it focuses on the energetics and making sure that there's a good flow of chi in the body. So Twina, does it mean push
Twin
pull?
means pull, Na means pull.
Okay.
Yeah. And this is the area we work on the kids. Now we won't work on adult, right? So those points or area we the pediatric Twina work on front, back, and hand, the palm and the back of the hand. So those, especially on the fingertip, I can demonstrate how to work on those points.
Okay, so you've got Twina, body work, Gua Sha, which is the scraping, which is the little, are those bone or stone? I couldn't tell.
It could made of jade, some made of jade, some made of the buffalo horn.
Okay, wow.
Yeah.
And Shonishin, is that the name of the little tool?
Tishan, you just say Tishan.
Tishan. Okay, and then the acupuncture points with the little metal balls, the gold-plated or silver-plated balls or pellets.
Yep.
And then the tiny pediatric needles. So if children are nursing, how do you treat kids at that age?
Yeah, if they're nursing, you mean during the treatment, what it looks like?
Yeah.
Is
it
good. Still like the kid, like the baby nurse on breastfeeding, it won't affect the treatment.
Okay.
Yeah.
So it's not like here where you'd expect to put your child down on a table, yeah, the child is held, they're breastfeeding, or they're being held or cradled, or if they're like a toddler.
Yeah,
have
like toddler, we let
toys.
them play the video, play the toys,
Just different
then
little
or
things.
play the or watch the cartoon.
Mm-hmm.
Yeah, so kind of distract and make them get them sit for a little bit of time, get the treatment. So
Okay.
the during the treatment, so it's really friendly, the kids friendly environment, and not really formal like a treatment.
Mm-hmm.
You have to lay down on the table, no movement.
No, because
you
can't do that with
walk.
children.
Yeah, you can walk. We can put a needle on different spot. Won't affect kids move around.
Mhm.
Yeah.
Okay. Well, we've got a young man here who's had a tummy ache. He's a 4-year-old, Lucas. He's holding on to his mom, and I don't know if you could bring him and just sit on the
Okay,
chair
Lucas.
beside. And we can do kind of a demonstration of
You can,
an approach.
Hold him sit on the chair. That's kind of a typical. Usually we.
Hi, Lucas.
The toddler sit on the parents' laps and talk. Here is the toy. You don't like it?
Look at.
Oh.
I think this is kind of interesting. These
So
stickers, Lucas.
Here is a sticker. You can make a puzzle, sticker puzzle. You can, yes. Give you this one. You can play. Okay. Yes. What you make a sun? Wear the sunglasses, right, son? Okay. So get a little bit more.
Lucas, have you met Dr. Hong before?
I think so. Many times.
Yeah. Yeah, that's what I was thinking.
Yeah. So let me show the points like here.
Look at this, just like your
okay.
hand.
Yay. Let me look at your hand.
Except this is a girl, but your hands look the same.
Yeah. Okay.
So this is some Twina techniques.
Yeah. So different finger indicate for different organ. Okay. So this is spleen. This is for spleen, whatever. This is for the liver. This is for heart. This is for lung. For kidney. So those under 5 elements, different organ. So let me work on your, because you said some digestive or stomach problem, right? Let me work on here. Go this way. Go this way. Go. Yeah, yeah. Just to rub it. Rub it.
How does it feel?
Good.
Feels good.
Feels good. So we just stimulate these fingertips. It helps. Okay. Like circular motion. Okay. So that's why I said pediatric and Twina, we use fingers. Not a lot of effort. For even younger baby, 1 or 2 finger enough.
Mm-hmm.
Okay.
Yeah, they're just little people, so.
Yeah, little people.
When Ohio legalized acupuncture, I went over on a study tour to a college that was way on the west side of China, and one of the rotations that they put me through was a pediatric, and I saw a little baby that was 18 months old who had been born with really severe cerebral palsy, and you could barely see a little bit of pulling on his right hand and his right lip. And when he was born, everything was curled up very much, and he got daily Twina, and it helped relax things. And I've never seen anybody really healed from cerebral palsy here in this country. And here they used daily touch, Twina, and it helped that birth injury. It was amazing.
Yeah. And also for pediatric Twina, the picture, the chart show the hand, but for a boy, we use the left hand. For a girl, we rub the right hand.
Okay.
Interesting.
And then croup, or things like respiratory. I've been seeing a lot of things on the Worthington Moms Facebook page about their kids having croup. Are there things that you
Yes,
can do?
it works very well. If the kids like him, we can do a little bit of cupping or Gua Sha. If they don't want to do that, we just use that finger do acupressure, and you can turn him, yeah, face to you. Yeah, face to you. Yay! You can just face your mom, kiss her. Yes.
Aw.
And the points around here, it's just use finger like this. Yeah, ticklish. Ticklish. Or we can use this tool, this kind of tool, this tool, okay? Ticklish. Yeah, so those technique and the front part, the chest, those stimulate those area. So when we do it, we usually do what? Press or rub it different way, okay? And same time stimulate certain points. That works very well, okay? So I think in February I had a patient, or in our clinic we had a kid. She is 3.5 years old, and she came here. That's our graduate. Refer them here. Mom took her here for a night bed wedding. And not that night, it's like a night time, wherever she sleeps. Then with the
Bed wedding?
yeah, bed wedding. And she also has some cough. And I just do the Twina, okay, and work on the chest, the back, and also abdomen, and also with a couple needle because mom's preference.
Oh, yeah.
And kids, okay, kids got needle before. So just one treatment, then I follow up and say, how's the kid doing? I said, that's great.
Okay,
Yeah,
so
it's dry.
it helps the bedwetting.
Yeah,
What
and
about
also cough gum.
constipation?
Help constipation. Yeah, because the kids is very thin muscle mass. Whatever stimulation easy affect the organ, regulate the organ to help the constipation. And also sometimes the baby has a colic for some reason, for no reason, just crying. Yeah, so those pediatric or say Chinese Twina massage, it works well. So also we have something calm them down. Other than just fingers, we can work on the those area to calm them down with the finger, not without using needle. Right? The baby can or
So calm them down like anxiety-wise, you mean, or?
Anxiety-wise,
Okay.
as well as they have
Night terrors?
night terrors, right? Night sleep issue. They wake up, you know. So that sometimes they sleep during the treatment.
Oh, wow, that's
Yeah.
nice.
We can put on here at the back. You put this one. See, you make a
Oh, and then you make a face.
face.
How cool.
Yes.
What about, what's that? Eczema. I've heard people asking about eczema a lot too.
Yeah, for eczema, that's definitely the bodies react to something, you know, like some food or some
Allergens?
So that's usually we can do the acupressure, but the Chinese herbs works better than those approaches.
Okay.
Yeah.
How young can Chinese herbs be taken? I'm not
As
sure.
long as they can take it, they eat probably after they eat.
Yeah, it doesn't have
Right,
sugar in it, it's
no,
not tasty.
right. No, won't. Yeah.
So after 6 months.
Or sometimes 1 year old,
Yeah.
they will add something old, but they probably five months later they added some solid food. Yeah. Which one do you like? You like this? You have more. We have more. You can pick up what you like. Okay. So this is a what? Panda, or the umbrella or badminton tennis, right? This is glasses. Yeah.
Does this help with seasonal allergies for children?
Yes. Yes, this
How does that
work on their immune system by stimulate the chest, back, and also the some spot on the hand. As I said, some like along the point here, okay, spleen points, long points, based on the diagnosis. Okay, so also for the young children, the diagnosis approach is a little bit different from adults in Chinese medicine. We look at the tongue, but we really don't depends on pulse. We look at the vein, index finger vein there, and see if it's red or it's bluish, purplish, or just pink red. So from there, we make a diagnosis. Older kids, like younger, 3 years younger.
How is this used with infections or viral bacterial infections?
For that infections, with the infection, there's some like inflammation, right? Accumulation fluid. Sinus around the ear, throat. So by doing Twina, we help moving the flow of those fluids. So help absorb. So
they would take their Western prescriptions, but also get some other support for their body to heal.
And also Chinese herbs is good for those infections, can avoid, because the antibiotics, it really damage the bacteria in the gut. You know, that's kind of uprooted those good bacteria is from the very young age that affect their whole body.
Oh, that's true.
Antibiotics.
So,
So, yeah.
So I know that kids, a lot of them, they eat candy and they go wild after they eat candy. Is there any point that can release heat or anything can calm?
Candy.
Yeah.
If they're eating too much candy and they're all hyperactive.
Yeah. Or sometimes they get angry a lot more. because
They do,
a lot of heat.
yes.
Yeah, so yes, the Gua Sha, the scraping technique, help release those heat. Gua Sha here and also along the arm, sometimes along the lower leg. Sometimes with Gua Sha around the forehead, it depends on the area and also diagnosis. Yeah,
Thank you.
so that's very good for kids to avoid those pharmaceuticals. Like for children, a lot of children has asthma, right? They
Asthma,
have to use an inhaler. With the pediatric acupuncture, they can decrease the dosage.
Oh, that's
And
good.
like inhaler, they just use a puff or one puff instead of two, and also decrease their medication and the visit, the emergency room visit.
Drops
Also,
down.
so many benefits for them.
What about ADD or ADHD?
So, yeah,
You're
that-
like nodding. I don't know why God made children so much more energetic than adults. We're like running to keep after them all the time.
Yeah, still the ADD, ADHD, those are based on the diagnosis. Some maybe different pattern based on TCM diagnosis. It work on different area. So focus on around the scalp region, on the back, or sometimes on the extremity by using the Twina or in combination with needle. Okay. So the needle more like on the scalp, it won't hurt, but also the kids can move around. You know,
Yeah.
It's not practical to let the ADHD kids stay with the needle and stay on the table for
Yeah,
30
that's
minutes.
just
No
not
way.
realistic, yeah.
No way. So, yeah.
It's hard to do sometimes for me. I'm like, isn't it 30 minutes yet? And other times I'm sleeping. Do children have to have something actually wrong with them to come in for a pediatric treatment?
Not necessary, because the one of basic philosophy of TCM is prevention, by balance the body to prevent from any condition. So that's it's good to do the pediatric acupuncture regularly to strengthen the immune system. Yeah, prevent the condition in the future. Yeah, or off the season, so you can come for treatment. Then once the season comes, or that can prevent the problem. Then even the kids got sick, but very mild. Yeah, can get recovered really soon, quickly.
Strong body is better.
Yep.
I know one of the premises of traditional Chinese medicine is to really bring the body into balance, and you're supplementing what's insufficient and you're reducing what's overflowing. Yeah.
Yeah,
That's-
that's how it works. Probably you are wondering how it works for the kids. So that's the kind of give explanation. Yeah.
Yeah.
Reduce the overflow and supplement the insufficient, so balance the body, and also stimulate the body's innate healing mechanism. If from young age can do that, that will be the really blessing for whole life. Yeah.
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 I remember meeting one time a pair of young women that were twins, and the one twin was very intellectual and became a professional musician. And when she was 16, she got gray hair in a streak, and her twin became a professional athlete and was really a sturdy build, and they looked the same in the face, but one had much energy and the other didn't. And I remember kind of wondering, since they were identical twins, and I remember Dr. Wong way back when he was here talking about the program, saying, well, some people are born with stronger chi, and sometimes twins get more than the other one.
Not a balance,
Yeah.
to split it to two. Yeah.
Yeah.
Someone get more, someone less. So yeah. So
Yeah. So there's things you can do to help bring up the chi that you're born with from your choices and your habits, and pediatric Twina and pediatric acupuncture really helps enhance that.
Yeah.
Is there anything else that we would like to share, or any questions that we don't think we've covered?
that's good. So,
Okay.
yeah, you're welcome to contact me if you have any questions regarding the pediatric acupuncture. Okay, thank you.
Thank you very much. Thank you, Lucas.
Bye-bye.
He's like into the stickers now.
Yes, that's good.
Thank you.